Do you frequently feel tired, even after a full night's sleep? Or maybe you're drinking water all the time and still feel thirsty. What if I told you these could be signs that your body isn't managing sugar properly? Meet type 1 diabetes mellitus, a condition where your body attacks its own cells that make insulin. Insulin is like a key that helps sugar from food enter your cells to give you energy. Without it, sugar builds up in your blood, causing problems. Think of it like a car with a full gas tank but a broken fuel line. The energy is there, but it can't get where it needs to go. This form of diabetes often shows up in kids and young adults, but it can happen at any age. So why does this happen? Imagine your immune system is like a security team protecting your body from invaders like viruses. In type 1 diabetes, this security team gets confused and accidentally attacks the insulin-producing factories in your pancreas, called beta cells. Once destroyed, your body can't make insulin anymore. Why does this confusion happen? It's likely a mix of genes and environment. For example, if your dad or sibling has it, you might be at higher risk, but it's not guaranteed. And sometimes, a virus might trigger this mistake, like a fake alarm causing the guards to shoot the wrong person. Scientists still don't know exactly what flips the switch, but they're working on it. How do you know if you or someone you care about might have type 1 diabetes? Let's play detective. Have you noticed going to the bathroom way more than usual, like every hour? That's because your kidneys try to remove extra sugar through urine. Are you always thirsty, like you just ran a marathon? That's your body begging for water. What about losing weight, even if you're eating normally? Without insulin, your body burns fat and muscle for energy. Not good. Other clues: feeling super tired, blurry vision, like looking through a foggy window, or mood swings. In severe cases, your breath might smell fruity. A red flag meaning your body is producing dangerous chemicals called ketones. If you spot 2 or 3 of these signs, it's time to talk to a doctor. First, they will ask about your symptoms, like the thirst, peeing, and tiredness. Then they will do blood tests. One simple test checks your blood sugar, high levels, possible diabetes. Another test checks for autoantibodies. These are the immune system's wanted posters targeting your own cells. Finding them confirms type 1. Also, a test called HbA1c shows your average blood sugar over 2 to 3 months, kind of like a report card. Once diagnosed, treatment starts right away: daily insulin injections or an insulin pump. Think of it as replacing the broken key with a spare one. You will also need to check blood sugar with a glucose meter, pricking your finger and putting a drop on a strip. Newer tools like continuous glucose monitors, or CGMs, use a tiny sensor on your arm, like a fitness tracker for blood sugar. With insulin, diet control, and monitoring, people with type 1 diabetes live full, active lives. Right now, we can't fully prevent type 1 diabetes because it's an autoimmune reaction, not from eating too much sugar. But research is looking into ways to stop it before it starts. For example, in kids with high genetic risk, scientists are testing if giving low-dose insulin or other immune-modifying drugs can calm the immune system and prevent the attack. But it's not ready for everyday use. The best we can do now is focus on early detection. If you have a family history, talk to your doctor about screening. Catching it early means fewer emergencies and smoother treatment. So, while you can't prevent it yet, knowing the signs and staying alert can make a big difference in how well someone manages the disease. Good news, science is moving fast. One exciting advance is the artificial pancreas, a system that links a CGM to an insulin pump. It automatically adjusts insulin every few minutes, like a smart thermostat for blood sugar. Some people call it a closed-loop system, meaning you don't have to think about every dose. Another hope is stem cell therapy. Scientists are growing insulin-producing cells in the lab and transplanting them into patients. Early trials show some people reduce or even stop insulin shots. Amazing! Also, research on vaccines to prevent or reverse type 1 diabetes is underway. Imagine getting a shot that teaches your immune system to stop attacking your pancreas. That's the dream. While these aren't mainstream yet, they're bringing real hope for a future with easier management or even a cure.